I want to talk to you about what they don't tell you before a radical prostatectomy. Not the surgery itself necessarily, not the survival statistics, not the Gleason score conversation. If you've been following this channel, you already know mine. I want to talk to you about the gap, the specific distance between what you are told in pre-surgical appointments, the pamphlets, the consultations, the informed consent forms, and what actually happens. Because there is a gap. And for most men, the gap is where the hardest parts of this entire experience live. I read the materials, I asked the questions. I have a very smart and engaged wife who asked questions that I had forgotten to ask. We were not passive participants in this process. And there were still 6 things that happened or that I experienced that nobody had adequately prepared me for or were far worse than I had expected. I'm going to tell you what they were because, as I've said this before on this channel, temporary awkwardness in a doctor's office is infinitely preferable to discovering something later that you weren't actually prepared for. And this time, the awkwardness I'm talking about is mine. Here's what they didn't tell me. The first thing they don't tell you, and I want to be straightforward about this, is the catheter. Now, they talk about it, they tell you. I want to be completely fair. It's in the materials, the surgical team mentions it, the urologist explains the timeline. What they don't prepare you for is what actually it means to live with it. Look, I went home with a catheter for 10 days, and I want to tell you what I think about that 10 days means in practical terms, not in a clinical pamphlet, but in your actual life. Getting dressed, sleeping, moving around your home, trying to find a position that's comfortable, the management of it all, the awareness of it every single hour of every single day. It's not necessarily painful. I don't want to overstate that, but it is relentless and it's uncomfortable. There is no moment in those 10 days where you forget it's there. It is physical, constant reminder of what your body has just been through. And here's the part I keep thinking about. I was prepared for it conceptually. I was not prepared for what it would feel like to be at home in my own house, in my own bed, and still feel completely dependent upon something external just to manage the most basic function of being a person. That's a different thing than understanding the procedure. If I'm being completely honest with you, the catheter wasn't the hardest part of recovery, but it was the part that hit me first and the hardest in those early days at home. The constant fear that it would somehow come out and what that amount of pain would feel like, how to manage the Foley bag. They give you some stuff, they show you for 5 or 10 minutes, like you've been in the medical field for 10 years or more, and then they wish you the best of luck until it's your turn. A few hours later, and you're still dealing with pain and soreness and just trying to get your head back into a sense of normal. It's a lot to process. What would have helped? Ask your surgical team specifically what day-to-day management looks like, not clinically, practically. Sleeping positions, clothing, mobility around the house, getting in and out of a vehicle. Ask those questions before surgery. Don't wait until after. They will answer them, but most of them won't volunteer that level of detail unless you ask. The second thing, and this one is harder to talk about, is urinary incontinence. Again, it's in the materials. The word is in there. Some patients experience temporary urinary incontinence during recovery. That's what they say. Some patients, temporary. Here's what the sentence doesn't tell you. It doesn't tell you that for many men, in fact, not some, but many men, incontinence in the first several weeks after radical prostatectomy is not a minor inconvenience. It's a significant disruption to your daily life. My surgeon told me that it can also last up to a year after surgery, and real recovery doesn't happen until at least 3 months, and in many cases, even 6 months. It doesn't tell you what the word temporary actually means in weeks, months, and even years, because temporary is not a timeline, it's a catch all. And it doesn't tell you what it does to your sense of dignity. I'm 60 years old. I've been a functioning, capable adult for my entire life. And in the weeks after surgery, I needed to think carefully about something I hadn't thought about since I was a small child. That is not something I was prepared for, emotionally or otherwise. The physical reality was manageable. The emotional weight of it, though, the quiet erosion of the kind of self-sufficiency I had taken completely for granted over the years, that was something completely different. Here's what I wish I had known before surgery. Pelvic floor exercises or Kegel exercises started before surgery can meaningfully reduce the severity and the duration of post-surgical incontinence. Not eliminate it, but reduce it. And that means something. So ask your surgical team about starting them preoperative. Not every surgeon brings this up. Some do, and if yours does, listen carefully and start immediately. And if they don't bring it up yourself. You are not being difficult by caring about your own health. You are not overreacting by wanting to be as prepared as possible for what your body is going to go through. You are being your own advocate. And in this process, you need to be. The third thing is what I'm going to call the nerve sparing conversation. Look, if you're facing a radical prostatectomy, you've likely already had some version of this conversation with your urologist. The nerve bundles that control sexual function run alongside the prostate. In nerve sparing surgery, the surgical team attempts to preserve those bundles. The goal is to protect as much function as possible. I was told this, I understood it. What I was not adequately prepared for, however, was for the word, and I want you to pay close attention to this word, attempt. We will attempt nerve sparing. In my case, I learned after the surgery that due to the advanced nature, they could not spare the nerves. One more thing cancer had taken from me. Look, I'm not telling you this in order to take hope away or that's facing if you're facing surgery or to scare you. I'm telling you this because I think every man deserves to have the specific conversation, not the general one. Your grade, your stage, your surgical approach, your age, these variables will matter. The answer for a Gleason 6 grade group 1 patient genuinely is different than from the answer for a Gleason 9. Ask your surgeon directly. Given my specific disease, grade, and stage, what is the realistic expectation for nerve sparing in my case? What does functional recovery look like at 6 months, at 12, or even at 2 years? Ask those questions. Sit with the answers, and then make your peace with the fact that some of what you're asking about is not fully within anyone's control. The surgeon's skill matters, your body's response matters, and some of it is simply the disease you have. That is not a comfortable truth, but it is the truth. The fourth thing nobody tells you about, and honestly, I wish someone had, because I would have laughed about it instead of just suffering through it. Here's what happens. With robotic assisted surgery, they make 4 or 5 small incisions across your belly. To do that work, they fill your abdomen with gas. It's how they get the space that they need to see what it is they're doing. Makes sense, necessary. Okay, fine. Here's the part that isn't in the brochure. That gas that they put in you has to go somewhere. Your intestines don't enjoy being poked around for several hours. They take offense, and their version of taking offense is going quiet. They just stop for a while. So now you've got gas that they put in you and an intestinal system that goes dark. And those two things together create a very specific, very unglamorous kind of misery. For me, that lasted 8 days, 8 days without a bowel movement. And I want to be specific about something because it matters. Don't push. If you strain too hard, trying to force something that isn't ready to happen, you can cause what's called bypass, where urine slips past the seal in your bladder and comes out around the catheter instead of through it. That's the type of stress you don't want on a body that's already healing. What helped? Well, walking around the house, walking around the yard, it didn't matter where you walked. Movement is what coaxes everything back online. So did the gas relief and the stool softener my team provided and prescribed. Use them. Don't be a hero about it by any stretch of the imagination. Of everything on this list, those are the things that were weirdly one of the most miserables. Not because it's serious, but because it's relentless and undignified, and absolutely nobody prepares you for it. So now I'm telling you, you're welcome. The fifth thing is the one that isn't in the pamphlet at all. There is no section in the pre-surgical materials that addresses what I'm about to describe, and I think that's a significant gap. Not because the medical team is negligent, but because this isn't a medical thing. It's a human thing. What does it feel like emotionally to hand your body over completely? Not the logistics, not the procedure, the actual experience of lying on a table, looking up at the lights, and knowing that when you wake up, something will have been removed from you permanently. I was ready. I was ready for that intellectually. I had processed that decision. I had made peace with the surgery being the right path. And yet I was still not ready for what waking up felt like. Not the pain was managed. Not the catheter, we've kind of already covered that part. The quiet, specific awareness that my body was different now in a way it would never stop being different. I think most men feel this. I think most men, they don't say it. I think most men assume it means something is wrong with them. It doesn't. It means you're paying attention to what this experience actually cost. That cost is real. It deserves to be acknowledged. And the men in your life or the women watching this who love a man facing this surgery, they need to know that this piece exists. Not so they can fix it, because they can't fix it, just so that when it shows up, and it will show up, that they're not surprised by it. And neither are you. So the sixth thing is different completely from the other five. The other five are practical things you can prepare for, questions you can ask, information that will make your physical experience more navigable. This one isn't. One is about the morning of surgery. March 31st, 2026, we got up before the sun rose. Sue and I drove to the hospital in the dark. I checked in. I went through pre-op, prep. Surgical team came in one by one, introducing themselves. The anesthesiologists, the nurses, the robotic assisted surgical system they would be using. They were professional and kind. And in some point in all of that, it became very quiet. Not in the room necessarily, but inside me. There is a version of yourself that walks into that hospital that you will never see again. I don't mean that in a morbid, dark sort of way. I mean it literally. The person who walked through those doors on March 31st, that version of Mike Jones, didn't know. He didn't know what he would wake up and be like. He didn't know what it would be like in the weeks to lose what he would keep. He didn't know about himself in the months that followed. He was about to find out. If you have that walk coming, I want you to know something. You don't have to walk in brave. You don't have to have it all figured out. You don't have to feel ready. You just have to walk in. The rest of it, your team will handle. And then you will find out who you are on the other side. I found out. I'm still finding out. And so I suspect so will you. I want to tell you one more thing about March 31st. When I walked through those doors, Sue sat in a waiting room alone. She sat in that waiting room for hours with one arm still healing from her shoulder injury just a few months earlier. And nobody, not the staff, not the surgical coordinator, nobody came over to that person sitting in that room and said, "How are you doing? Can we get you anything? Is there someone maybe we can call?" She was just there, invisible in the room where the most important thing in her life was happening. That video is coming up soon. If you're facing a radical prostatectomy, or if someone you love is, I hope something in this video gave you a word of for something you were already carrying but didn't know how to name it. The gap between what they tell you and what you experience. It's real. You're not imagining it. You're not weaker than other men for feeling the weight of it either. You are going through something significant, and you deserve to go in with every piece of information that is available to you. Leave a comment below. Tell me what you wish someone had told you before your surgery, or for your husbands, for your fathers. We learn from each other in these comments, and I read every one. If this video helped you, share it. There's a man somewhere right now who just got a diagnosis and is searching for a real account from someone who's been through this. Let him find this. Subscribe if you haven't. We publish every Sunday, and this conversation is far, far from over. My name is Mike Jones, and this is Jonesing for the Journey. And so, the adventure continues.